Aastrika Midwifery Centre opens at Trustwell Hospitals, inaugurated by Hon'ble Minister for Health and Family Welfare Department, Bengaluru, 24th October 2025. Aastrika Midwifery Centre, one of Bengaluru's most reputed maternity hospitals, founded by Doctor Janhavi Nilekani, today expanded its services to a new 8,000 square feet facility in the heart of Bengaluru, inaugurated by Shri Dinesh Gundu Rao, Honorable Minister for Health and Family Welfare Department. The new center has been launched
4 years ago. And in that time, and we currently are, a little further. In that time, families have been telling us for constantly that please come to the city. And I always reply that I cannot move unless there is a partner which works for us. And in Trustwell Hospitals, we found the ideal partner. We're so happy to be here. Thank you all so much. I just want to very briefly cover what Aastrika Midwifery Centre is. It's a boutique maternity hospital. We partner with Trustwell, where we bring in our specialty in obstetrics, gynecology and pediatrics as well. And of course, in partnership with Trustwell's infrastructure, where the operation theatres, NICUs, ICUs, etc. So our approach is towards clinical excellence, and we put a lot of emphasis on following evidence-based protocols. So that what are guideline-based, what are based on large trials, what are based on what is the latest cutting-edge guidelines when it comes to maternal and newborn health, that this should be implemented institution-wide, through and through, right, across the team, not just individual practitioners, but the overall culture of the hospital.
That looking at it from a very specific and a professional angle is very much needed, and giving it a focus, I think, is very much needed. And I think once you start giving focus to something, then you realize there are so many things that can be done, small things that can actually help in creating the right atmosphere and environment for a normal delivery. And I think that is something which I think what Aastrika is doing, is getting into the nitty-gritty and trying to work out the solution which will encompass so many different things. And I was there for a very brief moment in the center and just saw a few of the facilities that they have put out. And even the birthing room, there are so many things that can be done, and that's what they've done, the sensory part of it, and trying to create the right feel and comfort, and it's all both mental and physical. And so I think that detailed approach is what is I think really needed, and I must congratulate Aastrika for having done this. They have been doing it for a few years now, 5-6 years since they started, and they're working with the government also, trying to help us in training our nurses and training our people to and our doctors to how they can promote this. So they're working with the public sector, they're working in the private sector also, because private sector there's more, I think it's called LSCS or LCS? LSCS. Yeah, so there's more in the private sector, and if you go more in the urban areas.
ನಮಸ್ಕಾರ, ನಾನು ರೋಹಿಣಿ ನಿಲೇಕಣಿ ಅಂತ. ನಂದ ನಿಲೇಕಣಿ ಮತ್ತು ನಾನು ಜಾಹ್ನವಿ ನಿಲೇಕಣಿ ಅವ್ರ ತಂದೆ ತಾಯಿ. ವಿ ಆರ್ ದ ಪೇರೆಂಟ್ಸ್ ಆಫ್ ಡಾಕ್ಟರ್ ಜಾಹ್ನವಿ ನಿಲೇಕಣಿ, ಹೂ ಹಸ್ shifted her Aastrika Center, her birthing center, to Trustwell Hospitals in a new partnership. ಇದು ನಮಗೆ ಬಹಳ ಹೆಮ್ಮೆದ ವಿಷಯ, ಯಾಕಂದರೆ Aastrika was set up a few years ago to respect the mother to be during the process of birth. ಯಾಕಂದರೆ ಈಗ ಸಿಸೇರಿಯನ್ದು ಇನ್ಸಿಡೆನ್ಸ್ ತುಂಬ ಜಾಸ್ತಿ, ಭಾಳ ಜಾಸ್ತಿ ಆಗಿದೆ. ಅಷ್ಟು ಇರಬಾರ್ದು. ಆ್ಯಕ್ಚುಲಿ ನಾರ್ಮಲ್ ಡೆಲಿವರಿ 75% ಇರಬೇಕು. ನಮ್ಮ ಸ್ಟೇಟ್ನಲ್ಲಿ ಕೂಡ, ನಮ್ಮ ದೇಶದಲ್ಲಿ ಇಟ್ ಹ್ಯಾಸ್ ಬಿಕಮ್ ಟೂ ಮಚ್ ಟು ಹ್ಯಾವ್ ಸಿಸೇರಿಯನ್ ಆ್ಯಂಡ್ ನಾಟ್ ನಾರ್ಮಲ್ ಡೆಲಿವರಿ. ಸೊ ಜಾಹ್ನವಿ and Aastrika was set up so that you can do science, use good science, good evidence, and give mothers respect and give them what they rightfully deserve in the process of becoming mothers. So as parents, Nandan and I are really so proud today. There, I think, have been in the last just few years 700 births done with good science and lot of joy. 700 mothers are happy to have been born at the Aastrika hospitals. Now a new chapter is beginning, and I hope that by doing this, Janhavi will become a model for all other hospitals in India, because we must improve the rate of normal births in our country so that the mother and the baby have the best chance of long-term health. It is very important for the baby to go through the mother's birth canal. It gives lifelong immunity protection. All this is known. And we should respect that right of both the child and the mother, which is what Janhavi Nilekani is trying to do. And we are so proud of her. And thank you to the media for spreading this very important message. Thank you very much. Dhanyavad.